People will say, hey, you just sell medical products, but it is so much more than that. We give people the products, services, and education they need to live their best lives.
Healthcare is complicated. What we are really focused on is understanding what do our patients want and what do our patients need, and how we as Aeroflow can help them obtain those items and get those items covered by insurance.
I really like to tell my folks that you have the first step in the order process. The sooner and more effectively we can put paperwork into the system and get those patients set up, that is quicker time for them to get called by the rep. That's quicker time for their insurance to let us know if they're going to pay for it or not.
To me, it simply boils down to no matter how big you get, what great marketers you are, if all of that work and all that sophistication isn't producing a great customer experience that people are happy to introduce their family to, it's for nothing.
I did have a neighbor at one point who had a baby, and I just said, hey, do you have a breast pump? She told me how she got a breast pump, and she had these lactation courses, and I said, oh, I work at Aeroflow, and she was like, wait, that's where I got my pump. That's where I went through my courses, and it was amazing. That is the experience we want our patients to have.
I vividly remember having a conversation with an elderly woman. She didn't have a car and she didn't get out much, and she was on the phone with me crying when I called to tell her we were sending her supplies. She could now go visit her friends at church because she wasn't embarrassed about wetting herself. In urology specifically, we get to have those kind of stories every day.
We speak for the Medicaid population and try to provide comfort to a part of the population that often gets, forgotten about.
When I first started, we were just offering breast pumps through insurance, and now we have an entire catalog of items and services that we can offer to moms through insurance.
I'm fortunate enough to be leading the team that really has a focus on building relationships with the health plan partners to help them understand where the gaps are in care, to expand coverage for those that may not have transportation to get to a doctor to see a lactation consultant.
We work for the patient to make sure that that patient's services get covered if they're supposed to be.
One thing that I never anticipated is the reviews we get. This company changed my life. I finally feel like a person again. That makes every day really meaningful.
You always want to know, are you doing a good job? I remember a patient, she came in, she was stressed about her CPAP, and we talked for a while. And then the next day she came back with a pair of earrings. You feel like, oh, I did make someone's day.
At the end of the day, we want to hire people who care about the work that we're doing, that care about each other, that care about our patients and our mission, and we're not slowing down.